Hi, good afternoon, everybody. This is Dr. Rosenfield here at the Pearl Women's Center. I'm talking with Jade Carboy. You can sort of see your jacket there. There we go. Yeah, Jade is really, I think, our newest practitioner in our practice. Jade's background is as a nurse practitioner, so she loves seeing patients for wellness visits and also does a few other things. You want to talk about your practice just briefly?
Yeah, absolutely. I do, of course, routine gynecological care, annual screenings, birth control, kind of the whole gamut in that regard. I do also quite a bit of hormone replacement therapy and menopause management.
Which is exciting for a lot of our patients, because really any patient between the ages of probably mid to late 20s all the way through menopause, there are hormonal changes that are always going on in one's body.
Absolutely.
Which is an interesting segue, because those hormones are produced by the ovaries, and it happens to be Ovarian Cancer Awareness Month.
It does.
So we're going to talk for a few minutes about ovarian cancer and how we, as kind of the first line, address this in our patients. So why don't we talk a little bit about just like the generality of ovarian cancer. So there's different types of ovarian cancer, and some of them people are familiar with can be pretty bad. And I think that it's important for people to understand that the reason why ovarian cancer can be so deadly is that oftentimes it's not detected right away.
Right.
So I'm going to hand it over to Jade just to talk a little bit about early detection, maybe whether or not there's any blood tests to do, because I know we get asked that a lot, and how you in your practice recommend screening for ovarian disease.
Yeah, absolutely. So with ovarian cancer, the scary part is most of the time it's diagnosed late. The reason this is because it's like the great mimicker. So we see symptoms that are very, very vague and very common for women, especially women who are cycling and having menstrual cycles every month, right? So bloating, cramping, vaginal discharge, maybe some urinary symptoms. So oftentimes women will just kind of brush this off and think this is just my normal changes in hormones. Sure.
Now, with ovarian cancer, we do oftentimes see a correlation with other types of cancer as well. One of the most common being breast. And so we do some screening for breast and ovarian cancer. People may or may not be familiar with some of the genetic testing. Do you offer genetic screening to your patients?
Yeah, absolutely. And if there is a strong family history or a first-degree relative who does have a breast cancer or ovarian cancer, you can even sometimes get insurance to cover genetic screening.
So a patient comes into the practice for a wellness visit, is somewhere in the ballpark of, somewhere between 30 and 60, 70 years of age, and they come in and they ask you, they go, wow, I just heard this thing about ovarian cancer. What do I need to know? What would be kind of the initial information you would want to give to a patient, and how would you as a practitioner screen for that?
Yeah, absolutely. I think the most important thing is informing women to come in for their annual exam. And this is not just for their pap smear. So a pap smear depends on your age range. So ages 21 through 30, you're really only getting a pap smear every 3 years or so. And then after 30, it can be even every 5 years. This doesn't mean that women shouldn't be coming in annually for an annual exam and pelvic exam. So there's no perfect screening tool for ovarian cancer, and that's why a lot of times it's not caught. But if a woman comes in and gets a pelvic exam, it's a great chance for us to, one, talk about symptoms, maybe catch things that they haven't noticed, or examine them and see if they have any kind of pain or family history, even just by having a dialogue.
Yeah, and I think that's an interesting thing. Does ovarian cancer hurt? And the answer is it might, and it may not, right? Because the ovary is sort of almost free-floating in the pelvis, and so the ovary can get rather large, before we detect a mass or a lesion. So one of the things we do, we bring patients in for the wellness visit, like Jade was saying, and then if there is any suspicion of an enlargement, what would be the next step?
Getting imaging. That'd be a great next step. And then you mentioned like lab screening or blood work. There is one test, it's called the CA-125, where we can actually evaluate and see if there are any markers that could indicate some kind of issue going on with the ovary.
And I think that's a really good point. So the CA-125 is a blood test that it's not infrequent for patients to ask for it, but as a standalone test, it's not really a great test, and we don't really recommend that anybody just get the blood test by itself. because there's a lot of other reasons why that particular blood test may have an abnormal result.
Right.
I think as a standalone test, if the results are astronomically high, it's a pretty good indicator. And it's a really good indicator for recurrence. So patients that have had a history of cancer. What other things would you be recommending, as this awareness month for our patients to be thinking about? Are there any dietary recommendations, lifestyle changes that you can think of that would be pertinent for our patient population?
Sure. I think, general healthy living, making sure if you use tobacco products, see if you can cut down, stop using those. Heavy alcohol use, moderation's always key.
Yeah.
Eating well, taking care of your body are the best things you can do to prevent, any kind of course, health risks.
Right,
So.
right, absolutely. And then, of course, a lot of patients, what they'll notice is maybe some bloating, or that their pant size or their dress size has gone up, and they can't really understand why, or they think that there's a little bit of extra girth in their midsection. And I think that those are valid reasons to come in for an exam.
Yeah.
Really, if nothing else, just to hand over that level of stress to a practitioner, right? To kind of get a sense for what's going on. So really important for all of you to be thinking about these things. Cancer screening is hugely important. There's been so much in advanced blood testing and genetic screening now. It's oftentimes difficult for even us to keep up with this. So we would definitely encourage you to reach out. You can email info@Pearl Women's Center. How can people find you, Jade? Is it just on the website, I would assume?
Yeah, the website's a great way to get in contact with us. Just give us a call, and then we can always get you set up, even if it's just for an annual exam or even just to have dialogue.
And you're doing telehealth visits as well, correct?
Absolutely.
Yeah. So folks that may not feel comfortable coming in, especially if there's another wave of COVID, it's just a really nice way to touch base. Of course, we can't do a physical exam over the internet, but we can certainly kind of get things teed up for when you do come in for an office visit. So there's a lot more information on our website, and we would encourage you to go there, reach out if you have any other questions. And Jade has just unbelievable reviews from her patients, so you should make an appointment while you can, because her schedule is filling up, which is great to see.
Yeah.
Any other words of wisdom before we sign off on this episode of, I think we used to call this Ask the Pearl. Maybe we'll start that again.
All right. Yeah, come and see us.
All right. Thanks so much, and we'll be back with you next week for another episode.